The WHO has warned the public that Zika is spreading explosively across the Americas. While the symptoms from the virus itself are minor, including flu and rash, health experts highly suspect there may be a link between the illness and microcephaly, a disabling birth defect in which babies are born with abnormally small heads and underdeveloped brains. Anthony Fauci, director of the National Institute for Allergy and Infectious Diseases, says it would take a few years before a vaccine is readily available to the public. He says that until then, the way to combat the disease is mosquito control.
You can eliminate the mosquito and their larvae by insecticides and larvicides, or you could prevent the breeding by cleaning up still water in cans or tires or pots or what have you.
He says the public should be practicing mosquito avoidance by wearing long-sleeve clothing and applying repellent. On Monday, the WHO will determine whether to classify the virus outbreak as a public health emergency and provide guidance.
The WHO Geneva's involvement can help accelerate research and development for three things: much better diagnostic tests for Zika, antiviral treatments, I would say especially for women who are pregnant, because most people will get over it on their own, and vaccine development.
Dr. Beth Bell of the Centers for Disease Control and Prevention said via Skype that other regions could be at risk. 2 of the 25 countries that have reported cases of Zika have been outside the Americas: Samoa and Cape Verde.
These kind of mosquito-borne viruses, unfortunately, they have this capacity for very rapid spread. And, there are some factors, sort of modern-day factors, urbanization, large cities, international travel, that tend to promote this sort of spread.
The CDC has issued a travel advisory to affected countries, particularly for pregnant women at risk of passing the virus to their children. Some countries have taken additional measures, including El Salvador, whose deputy health minister has called for women to avoid pregnancy until 2018. Ramon Taylor, VOA News, New York.